I'm Yewei Xie. I'm a second-year PhD from Duke-NUS Medical School and mentored by the Prof. Nicholas Griff. So here I want to present some premature model structure and for our stakeholders to discuss later. So that's basically what Mo introduced before, so I skip this part. And there comes our objective, and we want to develop a compartmental model and simulate the spread from a one health perspective, and also estimate the disease burden. So I will go through the whole slide from describe the transmission dynamic and the model parameters. So here is the overview of our model structure. So we have two components. One is the epidemiological one, and the second is the economic component one. So from the epidemiological side, we want to simulate the spread of the AMR in different sectors, and then we can have output like the infection rate, the death rate, and also like how many people sick, and then we can calculate that kind of thing with the excess hospital cost and labor productivity loss and maybe dailies or other outputs to combine them together, and we can have our social economic impacts in the human society. So I will go through the model structure. So here is the transmission dynamic and the model structure we proposed. We have different sectors here, different compartment. And the first one is the susceptible individual one. So we assume the people who are healthy and don't have the disease. And then we have the resistant colonization one. Just like Mo mentioned before, like people in Clementi, they have colonization AMR strands in their gut, even though they don't have any contact or like infection before. And so we include this resistant colonization part in our model. And also we have susceptible infection, those people who have the infection but not AMR strands, and also the AMR infection part. And we consider the interaction between the animal sector and the environment sector. So here we are thinking about like these three sectors may combine, like may interact with each other, like animal may have colonized strands transfer to the human beings and also maybe to the environment. So we have these two parts. So here, that's how things go. The susceptible individual may become colonized with the resistant strands, and then they may develop into the AMR infection and maybe pass away, unfortunately, and recover. And for the people in the susceptible part, they may also develop into the susceptible infection without the AMR strain infection. And they may also develop into the AMR infection, like when they're in the ICU wards, and they can also pass away or recover. And then we have the interaction between the animal sector and the environmental sector. And the environment sector may play a role as a reservoir for the AMR strains from the animal sector. And the animal sector can have some kind of colonization strains transfer from the animal to the human beings. And they can also like transmit among the animals themselves. And here is the environment sector may affect the resistant strain colonization in the human beings. And also human can affect the environmental sector as well. And lastly, the resistant colonization part, the human beings may have a clearance, they lead to another animal sector, and they may have a clearance of the AMR strains and go back to the susceptible individuals. So that's what we are thinking right now, considering the model structure and also the transmission dynamics. And second part is the model parameters. So we figure out several parameters based on the transmission dynamic I presented before. So we have transmission rate from the different sector. We have transmission from the healthy people to the colonized one, and also have different transmission between the environment and the animal. And we also have rate like healthy individuals become the infection and become active resistant strain infection, and they have recovery rate and the mortality rate. The recovery rate and mortality rate mainly focus on the human sector. And here are some possible ways we may need to estimate the parameters in our model. The first one is the direct extraction from the existing literature, like the mortality rates and the recovery rates from the AMR disease. And the second one, maybe we need to indirect estimate those data from the existing literature, like the transmission rate or like a progression rate from colonization to infection. And third way is like we may need to explore or fit our parameters based on the real world data for some parameters with high uncertainty or limit data, and parameters that may influence by the local context. So here is the direct extraction. So we have mortality rate and recovery rate. We can just retrieve them from the peer-reviewed literature. And like here we have a mortality rate estimate here, and we can consider to pull them later and to generate our model parameters. And second part, we may need to think about maybe we can use some parameters from other modeling studies or from a meta-analysis, or use some expert opinions to make a best guess of the data. And also maybe we can use the back calculation if we know the hospital admission rate, and then we can consider the progression rate from the colonized part to the infection part. And third way is like we may have parameters with limit or higher uncertainty. So we may need to adjusting our parameters to fit our model with the real world observations, just like the Mo mentioned before in the Thai settings paper. So that's my proposed model structure for our project. Thank you.